Good evening, I'm Ron Trevino. Researchers at the University of Texas have pulled the numbers. Janelle Bluda is breaking them down and has more on what researchers believe should be done.
When COVID-19 hit America, correctional facilities quickly became a concern.
Experts warned that prisons and jails were going to become petri dishes for the spread of the virus.
Now, several months later, scholars at UT Texas like Michelle Deitch are taking a look at the impact.
It was stunning. The loss of life has been tremendous. There's been a devastating toll.
The report includes numbers from when the pandemic began until October 4th. In that time, it shows 231 people died from COVID in correctional facilities, 190 prison inmates, 14 jail inmates, and 27 staff members.
The report is just chock full of one devastating statistic after another.
Like the fact that 80% of the 14 people who died in jail were awaiting trial and hadn't yet been convicted of a crime. 21 had less than 2 years on their sentence, 9 had already been approved for parole, and the average age of an inmate who died in prison was only 64 years old.
People in prisons and jails tend to age a lot quicker than people on the outside.
And people inside Texas prisons have a significantly higher chance of getting COVID than those on the outside. In fact, 490% higher, according to the report. And they're 40% more likely to get COVID than the national prison population. Texas Department of Criminal Justice has released this statement in response, saying what's noticeably absent from the report is a discussion of the TDCJ's first in the nation sustained and aggressive mass asymptomatic testing campaign. But Deitch says that's not what this report was about.
What we were looking at is the number of deaths.
The true goal, she says, is to figure out what to do next.
We really need to be reducing the population in our prisons and jails to enable the people who are there to be safer and to get certain people out of harm's way.
In Houston, Janelle Bluda, KHOU 11 News.